Well, we are constantly using our hands every day, so it's no surprise that they're a source of discomfort every now and then. But when discomfort turns to pain, well, what can be done? Here to talk about it, orthopedic surgeon Dr. Brandon Shulman with the Connecticut Orthopaedic Institute. Thanks so much for joining us today.
Thank you so much for having me.
So I guess we'll start with, what are some of the common causes of hand pain?
So there are many common causes of hand pain. I think one of the most common causes as people get older is what we call basal joint arthritis, and more commonly this could be base of thumb arthritis. It's the most common area to get arthritis in the thumb because the thumb has a lot of motion. We're constantly texting and gripping things and holding our forks. And this can lead to extra wear and tear at the bottom of the thumb. So as people get older, sometimes they experience difficulty turning jars or doorknobs, or even gripping simple objects like a coffee cup. And often this is due to arthritis. Another really common cause are compressive neuropathies. And really what I mean by that is things like carpal tunnel syndrome. Which is when a nerve in the wrist gets compressed, and nerves don't really like getting compressed, so they start to cause some pain. That can be very severe at night, wake people up from sleep, and also cause some of the more typical symptoms that we associate with carpal tunnel syndrome, such as numbness in our fingers and difficulty grasping objects. Trigger finger is another common cause. That's when the finger clicks, and obviously fractures can also cause pain in the hand.
So we've talked about, obviously, the discomfort in your hand. When does someone know when it's time to see a specialist? How bad do they gauge it off their pain? Tell us a little bit about this.
Sure. I think that exactly what you said, Mackenzie. I think gauging it off their pain and also off of their function. So at the point when, taking a few Advil or Tylenol doesn't really allow you to do the activities you want to do, sleep through the night, grip your coffee cup without worrying that you're going to drop it, even, simple activities like, using your hand to write or to grasp simple objects or to type, if you have clicking in your finger, might be time to get that checked out.
Now, when you get it checked out, obviously you work with this a lot. What type of treatments are available for people who are dealing with this type of hand pain?
So I think a common misconception is that seeing an orthopedic surgeon or a hand surgeon leads to surgery. Most of these problems, and almost all of them initially, are treated without surgery, with either bracing, different types of medications, occasionally injections, and these can be very, very effective in relieving symptoms for the majority of patients that are experiencing pain in their hands.
Well, there's certainly a lot of information about this. You actually have an upcoming webinar, so tell us a little bit more about how people can find out more information if they have questions after this.
Yes, so I have an upcoming webinar. It is next week. It's part of the Hartford HealthCare webinar. And basically what we are talking about is the common causes of hand pain, and also getting a little more in depth about why people get pain in their hands, a little bit more about the anatomy and physiology. And this is a really good way to people to learn about these conditions.
Perfect. Okay. Well, thank you so much, Dr. Shulman, for joining us today.
Thank you very much for having me. I appreciate it.